Bismillahirrahmanirrahim. Quote of the day. A bad deed which you regret in your heart is 1,000 times better than the good deed that makes you feel proud. Today, topic of my presentation is sample size calculation for experimental study and post hoc analysis. Learning outlines are requirements of sample size calculation for experimental study with binary outcome, sample size calculation for experimental study with continuous outcome, sample size calculation for testing a hypothesis, and what is post hoc analysis. Learning objectives. In the end of presentation, the participants will be able to determine sample size for experimental studies and will be able to describe post hoc analysis. Now, what is experimental study? Experimental studies are ones where researchers introduce an intervention and study the effects. Experimental studies are usually randomized, meaning the subjects are grouped by chance. Randomized controlled trial. Eligible people are randomly assigned to one of two or more groups. One group receives the intervention, such as a new drug, while the control group receives nothing or an inactive placebo. The researchers then study what happens to people in each group. Any difference in outcomes can then be linked to the intervention. Now, example of randomized control trial. For example, post-menopausal women selected from population and randomly assigned. There are two groups. One group is study group that receives HRT, and the other group, control group, that receives placebo. Both groups observe prospectively to see who develops endometrial cancer. Then compare rates of endometrial cancer in the two groups. Now coming to sample size calculation. For sample size calculation, the following quantities needed to be specified at the design stage of investigation in order to calculate optimal sample size: power, significance level, variability, and smallest effect of interest. We have discussed many times about power, significance level, variability. Today I will discuss a little bit about smallest effect of interest. It is the minimal difference between the studied group that the investigator wishes to detect and is often referred to as minimal clinically relevant difference, or MCRD. This should be a difference that the investigator believes to be clinically relevant or biologically plausible. For continuous outcome variables, the MCRD is a numerical difference. For example, if a body weight is the outcome of a trial, an investigator could choose a difference of 5 kg as minimal clinically relevant difference. In trial with binary outcome, for example, the effect of drug on development of myocardial infarction, yes or no, an investigator should estimate a relevant difference between the event rates in both treatment groups and could choose, for instance, a difference of 10% between the treatment group and control group as MCRD. Even a small change in the expected difference with treatment has a major effect on the estimated sample size, as sample size is inversely proportional to the square of difference. For instance, if one would need 1,000 subjects to detect an absolute difference of 4.8%, 4,000 subjects per treatment group would be required to detect a 2.4% difference. Sample size for experimental studies. An experimental study is a type of evaluation that seeks to determine whether a program or intervention had the intended causal effect. Out of the various components of experimental studies, we are focusing mainly on studies designs comparing a treatment group and a control group. In studies, the outcome variable for evaluation could be binary, such as cure rate or survival rate, efficacy. In these, the outcome is in terms of yes or no. And there are studies aimed at evaluating the changes in the parameters which are of continuous nature, such as BP measurements, HbA1c values, etc. The computation of sample size is discussed separately for both types of outcomes. Now, binary outcome. In most experimental studies, a new drug is compared for its efficacy with the standard drug as control. The sample size in this situation is determined based on the following information: approximate value of efficacy or cure rate for standard treatment. For example, here we have taken the value as 60% or 0.6, that is P1. Approximate value of efficacy or cure rate for new drug, for example, 80%. that is P2, effect size, that is difference in efficacy of control and experimental group, for example 20%, as we have calculated through P2 minus P1, that is 80 minus 60, and we get 20. Level of significance, that usually we take it as 5%. How high should the probability of obtaining significant result be, that is power, for example 90% in this case. The formula used in this situation is as under. Here is the formula that will use in this situation. So in this example, the efficacy cure rate on standard treatment is 60%. The new treatment would be considered superior if it offers at least 20% more over the standard treatment. It is the desire to estimate the minimum number of patients required in each group in this study. The computation of sample size is as under. As we have discussed earlier, that P1 is 60 or 0.6, P2 is 0.8, and P we will get by P1 plus P2 over by 2, and that is 0.7, and value of alpha is 0.10 and beta is 0.20. So therefore, applying all these values in the formula, we get the number 82. So the sample size to study the above claim with 95% confidence level and 80% power will be 82. Now for another that is continuous outcome. In this, the mean of outcome variable in group 1 is M1, denoted as M1 in this formula. Mean of the outcome variable in group 2 is M2. Standard deviation of the outcome variable in group 1, that is sigma 1, and standard deviation of the outcome variable in group 2 is sigma 2. So the formula used in calculation of sample size is given below. This is the formula that is used for sample size calculation of experimental studies with continuous outcome. Now coming to the example, a nutritionist wishes to study the effect of lowering sodium in diet on systolic blood pressure. During a pilot study, it was observed that the standard deviation of systolic blood pressure in community with a low sodium diet was 11.3 mmHg, while that with high sodium diet it was 13 mmHg. If alpha is 0.05 and beta is 0.10, how many persons from each community should be studied if one wants to detect 3 mmHg difference in systolic blood pressure in two communities as significant? So applying all these values, that is sigma 1 standard deviation in group 2 11.3, and for group 2 it is 13, and applying these fixed values 1.96 and 1.28, and these minimum difference of 3, we get the sample size of 347. So a minimum of 347 persons from each community would be required to be included in the study. Now, equivalence of two interventions. When the standard therapy is invasive, expensive, or toxic, and the experimental therapy is conservative, one may be interested in showing that the experimental therapy is equivalent in efficacy of standard therapy rather than necessarily superior. In this situation, the null hypothesis may specify that the difference in success rate of the control therapy and standard therapy by up to D amount will be considered equivalent. Now, sample size calculation for testing a hypothesis, clinical trials or clinical interventional studies. In this kind of research design, a researcher wants to see the effect of an intervention. Suppose a researcher wants to see the effect of an antihypertensive drug, so he will select two groups. One group will be given antihypertensive drug and another will be given placebo. After giving these drugs for a fixed time period, blood pressure of both groups will be measured, and mean blood pressure of both groups will be compared to see if difference is significant or not. Complex formula are used for this type of studies, and we want to advise readers to use statistical software for calculation of exact sample size. The procedure for calculation of sample size in clinical trials, interventional studies involving two groups is mentioned here, and for groups for more than two groups, usually statistical software like GPower is used. Now, formula for sample size calculation for comparison between two groups when endpoint is quantitative data. When the variable is quantitative data like blood pressure, weight, height, etc., then the following formula can be used for calculation of sample size for comparison between two groups. This formula is used. We have to remember always that for quantitative outcome or data, usually this formula is used in which standard deviation is given. So SD is standard deviation, which we get from previous studies or pilot study. Then Z value for alpha, it is 1.96 as we get from the Z table at type 1 error of 5%. For Z beta, it is 0.842, that is at 80% power. D is effect size, which is difference between mean values. So now formula will be this, putting these values where Z alpha and Z beta is fixed and standard deviation, and D we get from the pilot studies or previous studies. For example, suppose a researcher wants to see the effect of potential antihypertensive drug and he wants to compare the new drug with placebo. Researcher thinks that if new drug reduces the blood pressure by 10 mmHg as compared to placebo, then it should be considered as clinically significant. Let us assume standard deviation 25 mmHg as found in previous studies. Suppose the researcher selects the level of significance at 5% and power 80%, and he thinks suitable statistical test in this condition will be two-tailed unpaired t-test. The effect size in this condition will be 10 mmHg, hence sample size will be. So applying these values in the previous formula, here we can see that these Z for alpha and beta, that is 1.96 and 0.84, and 25 is the standard deviation that we got from the previous studies, and 10 is effect size. So applying these values, we get the value 98. So in this case, the researcher needs 98 subjects per group. A formula for sample size calculation for comparison between groups when endpoint is qualitative. When the endpoint of clinical intervention study is qualitative, like alive, dead, disease, non-disease, male, female, etc., then the following formula can be used for sample size calculation for comparison between two groups. Again, the same for Z alpha and Z beta, and P1 minus P2 is difference in proportion of events in two groups. P is pooled prevalence, that is prevalence in case group 1 P1 plus prevalence in control group P2 divided by 2. In this way, we will get this value of P. So example is, suppose the researcher is interested in knowing protective effect of a drug on mortality in patients of myocardial infarction. He selected two groups of patients of MI. One group was given the drug and another group was given placebo. Both groups were kept under observation. At the end of study, death in both groups were compared. Let us assume the previous study says that 20% of patients of MI die within a specified time. The researcher feels that if a drug being tested increases survival to 30%, then the finding can be considered as clinically significant. Effect size will be difference in proportions, that is 0.2 minus 0.3, it is 0.2 at 5% significance level and 80% power sample size. So applying all the values that are given in this scenario, in the formula, we will get the value of 294. Researcher needs 294 subjects per group. So sample size calculation for simple calculation for sample size when comparison is for two independent groups can be done manually by given formula, but for more than two groups or for matched data and for other complex calculations, software should be used. Now, what are the common pitfalls while calculating sample size for experimental studies? The one is effects of selecting alpha and the power. Different assumptions of alpha and power will directly influence the sample size. Like a lower alpha and a higher power will both lead to a larger sample size and as a result to a higher cost. Then the second is estimating the difference in standard deviation, because using information from a pilot study often results in unreliable estimates of the variability and standard deviation. Now coming to next topic, that is post hoc analysis. When the estimated sample size cannot be included in a study, post hoc power analysis should be carried out. The probability of correctly rejecting the null hypothesis is equal to 1 minus p, which is called power. The power of a test refers to its ability to detect what it is looking for. The power of a test is our probability of finding what we are looking for given its size. Post hoc power analysis is done after a study has been carried out to help to explain the results if a study which did not find any significant effects. A post hoc analysis involves looking at the data after a study has been concluded and trying to find patterns that were not primary objectives of the study. Or in other words, all analyses that were not pre-planned and were conducted as additional analysis after completing the experiment are considered to be post hoc analysis. The word post hoc means after the event. So a post hoc study is conducted using data that has already been collected. Using this data, the researcher conducts new analysis for new objectives which were not planned before the experiment. Thus, analysis of pooled data from previously conducted trials could be a form of post hoc study. Now, at what stage can sample size be addressed? It can be addressed at two stages. Calculate the optimum sample size required during the planning stage while designing the study using appropriate approach and information on some parameters, or through post hoc power analysis at the stage of interpretation of result. The dangers of post hoc analysis. Post hoc power analysis has been criticized as a means of interpreting negative study results because post hoc analyses are typically only calculated on negative trials. Such an analysis will produce a low post hoc power result, which may be misinterpreted as the trial having inadequate power. As an alternative to a post hoc power, analysis of the width and magnitude of the 95% confidence interval may be a more appropriate method of determining statistical power. Now coming to MCQs. A researcher wants to compare an experimental group against a control group with regards to a woman using contraception. He expects P to be 40 and wishes to conclude that an observed difference of 0.10 or more is significant at the 0.05 level. The sample size each for experimental and control group will be the right option is A. This is how we calculate it. Using this formula, 2z square PQ over D square. And as we have seen the value of Z that at 95 confidence interval, it is 1.96. And the value of 0.4 and 0.6, we have got this, that is 40, expects P to be 40. And this D is minimum difference between the two groups. So the sample size we got is, applying all these values in the formula, we got 184. Now, to compare the healing rates of two surgical procedures, the traditional method resulting in a 70% healing rate and the study procedure at least 10% better than the conventional system, the minimum sample size calculation of a clinical trial should consider the following formula. Let us assume it is A, B, C, and D. So what will be the right option? A. Yes, A will be the right option. In order to describe the population estimate represented by a quantitative variable, discrete or continuous, the investigator needs to obtain the following parameter of that variable: population frequency, standard deviation, population mean, variance.
Standard deviation.
Yes, right answer will be standard deviation, because whenever we talk about the quantitative variable or outcome, we should always think for the standard deviation. To describe the measurements of mean arterial pressure from a specific population of patients that has never been described before with tolerable error of plus minus 5 mmHg, the sample size would have to be based on the standard deviation considering the values from this group. If a pre-test with 30 patients showed the standard deviation of 15 mmHg, the sample size would be 25, 35, 40, or 64. The correct option is 35 because using this formula and applying the values 1.96 at Z and standard deviation 15 and the error is 5, applying these values in the formula, we get 34.6 patients. A researcher wants to see the effect of his new drug, SSRI, for mild depression in adults. To get the optimal sample size, he should specify all of the following quantities at the design stage except power, significance level, smallest effect of interest, variance.
Variance.
Yes, right option is variance. As an alternative to post hoc power, analysis of the width and magnitude of dash confidence interval may be a more appropriate method of determining statistical power. 99.
95.
Right answer is 95. So here is the key and here are the references of my presentation and here I end. Thank you.
Okay, thank you very much, Dr. Meha. It is a beautiful presentation, very well prepared, and you have almost given all the answers that I have raised previously. And I'm very happy that you have done a lot of good work on it. Thank you very much. All of you may celebrate a very beautiful Eid with happiness, health, and prosperity. With all my prayers, Allah Hafiz. See you after Eid,
Thank you,
inshallah.
ma'am. Allah Hafiz.
Allah Hafiz.